24-hour pH monitoring considered to be the gold standard for the diagnosis of GERD. Positioning of the pH catheter are very important in order to get an accurate information. For 3-site pH monitoring, we use 2 separate pH catheters, one with a single sensor located at the tip of the catheter, and another one with 2 pH probes, one located at the tip of the catheter, and another one 10 cm proximal to the tip. If we look at this sketch showing the esophagus, the lower esophageal sphincter, the upper esophageal sphincter, and the pharynx, we place the single catheter with the single probe 5 cm above the upper margin of the lower esophageal sphincter. And if, for example, the upper margin of the LES will be at 43 centimeters, we'll locate it 5 centimeters above at 38 centimeters. The other probe has 2 sensors. We place the proximal one 2 centimeters above the upper margin of the upper esophageal sphincter. So if, for example, in this case, the UES upper margin is at 18 centimeters, we'll place the proximal sensor at 16 centimeters. This way, the lower one will be placed at 26 centimeters from the nostril. While the location of the probes at the distal esophagus and the pharynx are fixed, the location of the sensor at the proximal esophagus may vary, but it will always be below the upper esophageal sphincter and in the upper esophagus. 24-hour pH monitoring is an ambulatory procedure, and we ask the patient to keep their normal daily activity as much as possible. We also ask them to keep a diary and mark every symptom during the procedure. So later on, when we analyze the data, we could see if there is a correlation between the symptoms and reflux events. Esophageal pH recording are analyzed automatically using computerized software, so we could easily get the number of reflux events and the time when the esophagus was exposed, but there is no reliable computerized analysis for pharyngeal pH, since the pH probe could get dry or could lose contact from pharyngeal wall and could read pH drop, which is really artifact and not real pharyngeal event. For that reason, we need some criteria for the analysis of pharyngeal pH. As for the esophagus, for real pharyngeal reflux, the pH should drop below 4. It should not related to eating or drinking. The pH probe could report pH drop related to eating and not to real reflux events. In those cases, the pH will drop first at the pharynx, followed by proximal esophagus pH drop, and lastly at the distal esophagus. To avoid those mistakes, we exclude the eating and drinking time from the analysis. For a real reflux event, pH drop has to be simultaneously or preceded by proximal and distal esophageal pH drop. The third criteria is the magnitude of the pH drop. Gastric refluxate might dilute within the esophagus. The absolute pH at the pharynx should be less acidic or at least equal to that of the proximal esophagus. The proximal esophagus acidity should be less or equal to that of the distal esophagus. Here we have some examples of 3-site pH recording. The upper line represents the pharyngeal pH recording. The middle one represents recording from the proximal esophagus, and the lower one records from the distal esophagus. Here we could see distal esophageal reflux. In this case, the pH dropped only at the distal esophagus and did not reach the proximal esophagus. In this case, the pH dropped in both esophageal probe. The pH is lower, more acidic at the distal esophagus than the proximal esophagus. And in this case, the reflux state did not reach the pharynx. But in the third event, the reflux state moved all the way into the pharynx. If we look at our criteria, the pH dropped below 4 at all three sites. pH dropped first or simultaneously at the distal and proximal esophagus, and only later at the pharynx. And the magnitude of the pH drop, the pH drop greater at the distal esophagus, less in the proximal esophagus, and even less at the pharynx. So this represents a real pharyngeal reflux event.